If overweight, shedding pounds is one of the most important things you can do. The problem is most diets don't address the underlying factors that make it difficult to lose weight. A comprehensive approach to weight loss can help you slim down and also improve many of the biomarkers of health. Lemon verbena and hibiscus have numerous medicinal properties. Multiple trials have shown a lemon verbena and hibiscus combination promoted weight loss and it supported healthy cardiovascular biomarker levels in overweight and obese subjects. In a study on 60 mildly overweight women on an unrestricted diet, 176 milligrams of saffron per day for 8 weeks produced on average a weight loss of about 2 pounds. Much of this weight reduction was attributed to a reduction in snacking frequency. Dehydroepiandrosterone is an adrenal steroid hormone and is a precursor to sex hormones like testosterone and estrogen. In a randomized control trial, 125 elderly men and women had 50 milligrams of DHEA daily for 2 years, and it lowered visceral fat mass, improved glucose tolerance, and decreased the levels of inflammatory cytokines. 7-keto DHEA is a metabolite of DHEA, and it's been shown to increase resting energy expenditure. Mangosteen is a tropical fruit native to Southeast Asia, where it's been used traditionally as a treatment for diabetes. Another medicinal plant, known as East Indian globe thistle, has demonstrated anti-inflammatory, blood glucose lowering and lipid lowering activities in preclinical trials. Placebo-controlled studies have noted the efficacy of the mangosteen for increasing the weight loss in subjects who are overweight and are obese. Gynostemma pentaphyllum, also known as zhaozhalang. Compounds extracted from this have been shown to activate adenosine monophosphate activated protein kinase, or AMPK, which is a critical enzyme that regulates cellular metabolism and other cellular functions. In a randomized placebo trial that included 80 participants with obesity, 450 milligrams of the Gynostemma extract per day for 3 months resulted in decreased body weight, total abdominal fat area, body fat mass, percentage body fat, and body mass index. Obesity is a multifaceted chronic disease characterized by excess body fat and increased body weight. Obesity impacts all aspects of physiology and is associated with increased risk of most major chronic health conditions like type 2 diabetes, cardiovascular disease, and some cancers. It's also associated with a reduced life expectancy. Alarmingly, the prevalence of obesity is increasing around the world, and the United States has one of the highest rates. Many people mistakenly believe that weight gain and obesity can be easily resolved with simple adjustments to the energy expenditure. Less energy in calories, and more energy out as exercise. While calorie reduction and regular exercise are key components of a healthy weight loss program, the complex nature of weight management and obesity makes successful weight loss extremely challenging. Some of the intrinsic factors that influence body weight reduction are genetics and epigenetics, the complex biology of adipose tissue, adipokine signaling, appetite regulation pathways, the microbiome, insulin sensitivity, circadian rhythms, and hormones. Some of the extrinsic factors that influence weight loss are diet, exercise, lifestyle, and stress. Many people find long-term maintenance of weight loss is the most difficult aspect of successful weight management. With this in mind, researchers have collected observations regarding the habits and behaviors of individuals who are able to avoid weight regain. In general, successful and sustained weight loss has to be corrected with the following. Eating a low-calorie diet that's high in fiber, high in low-density foods such as fruit and vegetables, moderate to high in protein and low in fat. Avoiding sweetened drinks, avoiding refined carbohydrates, eating breakfast, avoiding nighttime eating, having regular daily meals, avoiding snacking. Engaging in regular exercise, getting adequate sleep and maintaining a healthy circadian rhythm. self-monitoring of body weight, receiving support from those close to you, and healthy stress management. The mainstay of weight loss therapy is calorie reduction and exercise. Counselling, whether in individual or group sessions, increases the long-term efficacy of a lifestyle-based approach to weight loss by emphasising strategies for maintaining adherence. However, for those with obesity or weight-related health problems, medical interventions may also be a consideration. Medical approaches to weight loss can involve a combination of many different medications, such as metformin, orlistat, naltrexone, acarbose, and others. As well as drug therapies, there's bariatric devices such as gastric balloons, vagal nerve blockade, gastric emptying systems, and gastric artery immobilization. There's also various forms of bariatric surgeries. Obesity is a multifaceted chronic disease, and it's characterized by excess body fat and increased body weight. Metabolic dysfunction due to unhealthy expansion of fat tissue is a hallmark of obesity and its complications. Abdominal obesity is the most commonly occurring component of metabolic syndrome, a group of interrelated risk factors for type 2 diabetes and cardiovascular disease. Central obesity, high blood pressure, high cholesterol and triglyceride levels, and high blood sugar levels. There's multiple contributing causes of obesity and metabolic disturbance, encompassing complex factors like human behavior and neuropsychological drivers, environmental conditions, genetics and epigenetics, hormonal and inflammatory signaling, and the microbiome. As a metabolic disease, obesity impacts all aspects of physiology. Obesity is associated with an increased risk of most major chronic health conditions like type 2 diabetes, cardiovascular disease, and some cancers, and it's also associated with a reduced life expectancy. Alarmingly, the prevalence of obesity is increasing around the world, and the United States had one of the highest rates. Based on the most current data collected through the ongoing National Health and Nutritional Examination Survey, the Center for Disease Control and Prevention reports obesity is more prevalent now than ever in the US, affecting about 40% of adults and 18% of the youth. The numbers are highest in those 40 to 59 years of age, and higher in women than in men. Nearly half of the US adults are projected to be obese by the year 2030. A comprehensive approach to a healthy weight loss includes a healthy diet, regular physical exercise, and social support. This strategy may be enhanced by integrative interventions that target various pathways which can support metabolic health. In some cases, medications and surgery are considerations. This protocol explores the most current scientific understanding of obesity. It also presents the scientific evidence for various dietary and lifestyle-oriented weight loss strategies, and evaluates the role of supplements in an integrative weight loss program. Well-supported nutritional supplements, including green tea, green coffee bean, chromium, whey protein, and probiotics, are further described. Excessive weight gain can change body composition by increasing fat tissue mass, and this can lead to a cascade of disordered metabolic signaling, and this accumulates in diseases like diabetes and cardiovascular disease. Overweight and obesity are associated with a host of health problems related to mechanical and metabolic stresses, including osteoarthritis, type 2 diabetes, stroke, coronary artery disease, and cancer. As a result, individuals with obesity are more likely to die prematurely than their normal weight counterparts. On the other hand, weight loss is associated with many health improvements. Just 5 to 10% of body weight loss through dietary interventions can reduce fat mass, triggering positive changes in metabolism and lowering the risks of metabolic disorders. The benefits are even greater with at least 15% of body weight loss. Many people mistakenly believe that weight loss and obesity can be easily resolved with simple adjustments to the energy expenditure equation. Less energy in and more energy out. While calorie reduction and regular exercise are key components of healthy weight loss, The complex nature of weight management and obesity makes successful weight loss extremely challenging. Metabolism, in simple terms, is the entire process of transforming nutrients into energy. The macronutrients of food, namely protein, carbohydrates, and fat, are broken down and they can be converted into energy. That energy is either consumed in the process of digesting the food and moving the nutrients, used to run the ordinary workings of the body cells and the tissues at rest, or it's used to fuel physical activity. The total amount of energy that a body uses over time to support all these functions is sometimes called metabolic rate. The energy used by the body at rest is known as the resting energy expenditure, and it's the largest contributor to the metabolic rate, accounting for 60 to 75% of the total energy expenditure. The resting energy expenditure is not static, but rather it's subject to the adaptive mechanisms in the body to resist changes in weight and fat mass. For example, when calorie intake is reduced, the body compensates by decreasing the resting energy expenditure. However, regular exercise increases the resting energy expenditure, in part due to the higher metabolic activity of the muscles compared to the fat. So it's important to couple the dieting with exercise. When energy intake exceeds the overall energy demand, signals from insulin and other metabolic regulators trigger the nutrient uptake and the storage. Tissues such as the liver and the muscles have limited capacity to store glucose as glycogen, but fat tissue has virtually unlimited capacity to store excess energy as fat. When energy intake is less than the body requires, fat stores are generally preserved until glucose stores are depleted. Fat is the most efficient and abundant source of stored fuel, and our fat stores allow us to maintain long-term energy balance. However, the balance between energy intake and overall energy expenditure is also malleable, and multiple factors, including the composition of the diet, the timing of the eating, and the timing and intensity of physical activity, influence how stored energy is used. Overcoming the body's adaptive mechanisms for preserving body weight and fat mass is essential for an effective healthy weight loss program. In fact, metabolic adaptation to weight loss is estimated to account for 50% of the discrepancy between the expected and the actual weight loss in individuals with obesity on weight loss programs. A large number of obese individuals have overt metabolic diseases like type 2 diabetes or cardiovascular disease, or they have multiple signs of metabolic dysfunction, such as high triglyceride levels, disordered cholesterol levels, high glucose levels, high blood pressure, and or evidence of insulin resistance. But a substantial subset of obese individuals show no or few signs, and these are often referred to as metabolically healthy obese people. Because this term has no official definition, estimates of the prevalence of metabolically healthy obesity vary. One report examined the findings from 40 studies and determined that among obese individuals without overt metabolic disease, approximately 1/3 are metabolically healthy. Unfortunately, long-term studies indicate 30 to 50% of people with metabolically healthy obesity gradually progress to a metabolically unhealthy state. Furthermore, although metabolically healthy obese individuals have lower rates of type 2 diabetes, cardiovascular disease, and death from any cause than their metabolically unhealthy counterparts, they're still at a higher risk of developing metabolic abnormalities, like elevated blood pressure and abnormal blood lipid profiles, compared with normal weight people with good metabolic health. Researchers have found, compared with obese individuals who are metabolically unhealthy, those who are metabolically healthy are more physically active and they have better cardiorespiratory fitness. There's also growing evidence that dietary factors such as a low consumption of sugar and sugary beverages and a high intake of whole fruit, whole grains, and vegetable protein are associated with better metabolic health in these obese subjects. Differences in the gut microbiome and genetic factors affecting the fat tissue function also play important roles in determining the metabolic health status in people with obesity. For more information, continue in the series on weight management, and for information on herbs, supplements, and natural treatment protocols, check out my website.